Hello everyone, thank you for being here. For the first part of this fundamental class, we are going to talk about the anatomy of the tooth and the morphology of the tooth. Now, before we start, we have to know the names of the two main jaws that hold our teeth. Right, the upper jaw is called the maxilla, and the lower jaw is called the mandible. So this being the maxilla, which holds the palate as well, and your maxillary teeth. So maxilla holds your maxillary teeth or upper teeth. And it's the bone that has the first quadrant of your dentition and the second quadrant of your dentition. And then the lower jaw, which is the mandible, here, has the third quadrant of your dentition and the fourth quadrant. So the first quadrant was on the right, the second quadrant was on the left, third quadrant is also on the left, and the fourth quadrant is on the right side. So this is the mandible, and these are the mandibular teeth or lower teeth. This is the maxilla and the maxillary teeth. Another very important difference between the maxillary bone and the mandibular bone to keep in mind is that the maxillary bone is made of spongy bone and the mandibular bone is made of compact bone. Again, so maxillary bone is made of spongy, or we also say cancellous bone. It's much softer compared to the mandibular bone, and the mandibular bone is a compact bone and it's much harder. The next part, I'm going to talk about the anatomy of the tooth itself, and then we will go ahead and talk about the different forms and names of the different teeth. So when it comes to the tooth itself, every tooth has a bunch of layers, you could say. Let me pick another color. No, this is good. Okay. So let's draw any tooth here. Okay. Every tooth has a crown and a root. Okay, now some teeth have multiple roots, some have single roots, but every tooth consists of crown and root. Okay, now the layering of the tooth and how they're divided. We'll start with the outermost layer of the crown. The outermost layer of the crown is called the enamel. Okay, we'll leave it white like this. It is basically the outer layer of your teeth that you see, and it is the strongest and hardest tissue in your human body. The second layer that comes right after it, I'll put it this way. This layer here is called the dentin. Okay, it is not as strong or as hard as the enamel. It's a little softer and it's a little more yellow. So usually if you see that you're getting decays in the initial stage, it takes longer for the decay to penetrate through because you have enamel. But once it passes the enamel stage and goes to the dentin, it grows faster because dentins aren't as strong as enamels. Now, the difference between an enamel and dentin and every other layer is that enamel ends exactly where the crown is and it doesn't continue on to the root, but the dentin does. So you do have a layer of dentin. You do have a layer of dentin as well in the root portion of your tooth. Okay, we're going to talk about the outer layer of the root as well. This outer layer of the root, let's use a different color. Is called the cementum. Okay, the cementum is very rough comparing to the enamel, and I'll also explain why. Enamel has a very smooth layer. As you can see, if you touch or feel your teeth with your tongue, you'll notice that it's a smooth outer layer. But for the cementum, it's not like that. It's more rough because it's holding on to ligaments and it's holding on to the bone. Now, the bone that surrounds our teeth is called the alveolar bone, although it's part of the mandible, and this one is a part of the maxilla. But the bone itself, the bone that's surrounding our teeth and holding our teeth in place, is called the alveolar bone. So the alveolar bone is, use this. So the alveolar bone is the bone that basically holds our tooth in place. Okay, this is the alveolar bone. And the way the alveolar bone holds onto the tooth is by ligaments that are attaching the alveolar bone to the tooth. And these ligaments are called the periodontal ligaments. These periodontal ligaments are what hold the tooth in place and attach them to the alveolar bone. If you ever had any of your teeth extracted and you notice this weird noise while they're loosening your tooth to pull it out, that noise is the periodontal ligaments breaking so that they could mobilize the tooth and extract the tooth. And just before I go into the innermost layer of the tooth, I will talk about this one anatomic aspect of your tooth, which is right here. This area is where the enamel and the cementum meet each other. This point here is called the, let me erase this maxilla. So this point here is called the CEJ. The CEJ stands for the cemento-enamel junction. And this is where the enamel and the cementum meet each other. That's just one other aspect I wanted to add. And now, the innermost layer of the tooth, which is, you could say, the lifeline of your tooth. This layer inside. This layer is the layer that holds your blood vessels in that tooth and the nerve. So the nerves and the blood vessels basically keep the tooth alive by entering the tooth from this point, which is called, this area here is called the apex. The apex of the tooth, right here. And this layer here is called the pulp. Remember, pulp is the lifeline of the tooth, and it is what keeps basically the tooth alive. And the vessels and the nerves enter the tooth through this apex. So just to give you a better understanding, this being a tooth, okay, I'm not going to go into detail about what tooth it is because we will get to that. But if we open it and look at the inside, this outer layer here would be the enamel. This yellowish layer would be the dentin, and this bloodline here would be the pulp. The layer that's outside the dentin here, as you can see, the dentin goes into the root as well. This was the crown and this was the root. This outer layer is the cementum. This doesn't have the periodontal ligament or the alveolar bone. This is just the tooth itself. Another example I could show you, this is a back tooth which has multiple roots. But if we look at the inside, you can notice the same thing. The enamel, and then this part being the cementum. The dentin being the inside, the yellow part, and then this, the pulp, being the bloodline where it has the nerves and the blood vessels. Let's open this and see. Oh, same thing. So the next thing I want to talk about is the different types, or you could say the different shapes of teeth we have in our mouth. As you can see, they don't all look the same, of course. And our teeth are divided into quadrants. Like we said, the first quadrant, second quadrant, third quadrant, and fourth quadrant. Now, other than that, we also divide them into front teeth and back teeth, which is anterior teeth and posterior teeth. I'm going to write that before we continue. So here I'm going to write front being anterior and back being posterior. Okay? So again, we have the anterior teeth and posterior teeth. And in terms of the quadrants, we're supposed to, in adult teeth are also called permanent dentition. Our baby teeth, like we say, is called the primary dentition. In a permanent dentition, we should have 8 teeth per quadrant. The 8th tooth in each quadrant being the wisdom tooth, which you usually get when you turn 21, around the ages of 21. So this dentition here does not have the wisdom tooth. So you can see 7 tooth per quadrant. This being the midline, making this 7 teeth in this quadrant, 7 here, and 7 here. So you could say, like, if this was an actual person, you could say they either got their wisdom tooth extracted, or maybe they haven't erupted yet, or they don't have them. Anyways, so as you can see, the teeth don't look like each other. Every tooth has its own shape in its unique way, and each one of these has a name. Let me erase this, and then we can focus on each name of every single one of these teeth. So starting from the midline, right here, the first teeth that we see in the maxilla or the mandible, they have the same names. These are called the central incisors. Okay, I'm going to write, every time I say them, I'm going to write them so it's easy to remember. So you have the central incisors. These bumps that you see on the incisal edges of the central incisors, these are called mamelons. They are present on newly erupted permanent central incisors. So on your adult teeth, when they newly erupt, usually this tooth erupts around the age of 6 years old. And as your age gets older, they start to wear away. The next one are the lateral incisors. So you have the central incisors that are right at the midline, and then you have the lateral incisors which come right after them. Lateral incisors. The next tooth would be the canines. As you can see, this, and this. Now, before I talk about the canine, the incisors in general are used for mostly cutting our food. The canines are mostly used for tearing. And canines are also called cuspids because they're made of single cusps as well. And cusps are basically eminence, protruding, you could say. Our posterior teeth have a bunch of cusps. The canines have single cusps. and hence why they're called cuspids. And this separates, the canines separate our anterior teeth from our posterior teeth. So again, just a refresher, these are maxillary teeth in the upper jaw, these are mandibular teeth in the lower jaw, and then if we're separating them in terms of anterior and posterior, the canines, the laterals, and the centrals are our anterior teeth, and I will talk about the rest, which are our posterior teeth. So let's talk about the functions of our anterior teeth. You have your 8 incisors at the front of your mouth. Their function is to support your lips, bite into your food, and they also help in pronouncing words. The canines, that are 4 in total on the sides of your incisors, their function is to cut food and tear into food. Also, they do support your lips, and they also guide your jaw in place when you close your mouth. I said canine are also called cuspids, or cuspid if we're talking about a single one. And after this, we move into our posterior teeth. Our posterior teeth in the permanent dentition, or adult teeth, we have the first and the second premolars. Again, here we have the first and the second premolars. Okay, the premolars are called bicuspids because they have 2 cusps. If you can see here, we have one and another one here. Here, first and second, same thing. So the premolars again are called bicuspids, and in the primary dentition, so in your baby teeth, you don't have premolars. These are actually, the premolars here are actually replacing your primary molars, your baby molars. But for your adult teeth, molars are what come after the premolars, the bigger tooth, and are used to chew down food. These molars, basically this is the first molar, the second molar, and the wisdom tooth that is not present here is your third molar. Now, again, premolars, and we have 3 molars. So these 3 molars don't replace any primary teeth or any baby teeth. But these premolars do replace your primary molars. So, as you can guess now, in your primary dentition, or the teeth babies have, it's 5 teeth per quadrant. They only have the central, the lateral, the canine, and then the 2 molars. Later on, obviously the primary centrals, laterals, and canines get replaced by permanent ones, but the primary molars get replaced by permanent premolars. And then you have the 3 molars that come in adult teeth. Further down this class, you will also learn about their eruption and which one erupts first and which one erupts next in general. So let me write down the premolars and the molars. So, like I said, premolars are also called bicuspid, having 2. Molars are the bigger teeth in the back. They have 4 to 5 cusps. Usually, the maxillary molars have 4 cusps, and the mandibles have 5 cusps. Now, the first molars, some or a lot of the times, the first molars, not the second or the third, the first maxillary molars, so the first upper molars, can also anatomically have an extra cusp. You might be able to feel it if you touch the inner surface with your tongue. By the way, we will talk about surfaces in the next section, and we will also learn the names of each surface. But for now, let's call it the inner surface. If you feel it with your tongue, you might be able to feel it, and there's an extra cusp, or supposed to be, you can't see it here, which is called the cusp of Carabelli. We will learn the names of each cusp moving in the surfaces section. But for now, just know that the first molars can have an extra cusp. Other than that, generally they have the upper or the maxillary molars have 4 cusps. The mandibular molars usually have 5 cusps. Another thing that we can add to the anatomy of our teeth is the number of roots each tooth has. The central incisors, the lateral incisors, and the canines have single roots. So just like the drawing we had, or as you can see here, this is a canine. Canine as well has a single root. Okay. Now there can be exceptions, anatomic exceptions. A lot of times the lower canines sometimes might have the root dividing into two roots at the end. And again, these are anatomic differences, but usually, and going by the book, the central incisors, the lateral incisors, and canines have single roots. Okay, in the maxilla and the mandible. Next, we are going to move to the premolars. The premolars is a little tricky. Most premolars have single roots again, just like your canines and the centrals and laterals, except the upper first premolars. The upper first premolars can have two roots, okay, and they would be pointing towards the lips and towards the palate. Okay, we will learn about the names of the surfaces later on. But for now, you have one, or I could say it actually. So you would have a buccal root and a lingual root. And you will learn about these words in the next section, in the surfaces section. So yes, only the first premolar can have two roots, usually. The other premolars have one root. Now going to the molars, the lower molars, the mandibular molars, have two roots. And one is towards the front, the anterior side, or you could say we call it the mesial side, because it's towards the midline. And then we have another one, which is the distal. And so opposite to this would be towards your cheek and towards your palate. For this one, it would be towards this and this tooth. So it would be two roots. If you're looking at it this way, they would be like this. Although for your premolars, it would be like this. So, so your lower molars have two roots. But your upper molars, your maxillary molars, usually have three roots. So if you're looking at a tooth like this is a maxillary molar. Okay? And, well, we don't have this section and we're looking at the inside. But these are two roots. And usually this is how it would be, or in this way. So you would have one bigger root towards your palate, and you would have two roots towards your cheek, or we say the buccal side, and it would be a mesiobuccal root and a distobuccal root. Mesiobuccal towards the mesial, distobuccal away from the midline, but again, they're buccal, or they're towards your cheek, and this would be lingual, or towards your palatal. So again, your maxillary molars will have three roots. Your mandibular molars will have two roots. Premolars usually have one root, except the upper first premolar would have two roots. And then your canines, centrals, and lateral incisors mostly have single roots. When it comes to the primary dentition or baby teeth, it's almost the same, except your primary molars, maxillary, will have three roots, but they get replaced by premolars, which would have one, and this one would have two. And your mandibular primary molars would also have two roots, but get replaced by single-rooted premolars. But again, molars having two roots in your adult teeth. When it comes to the function of molars, the molars are specially designed for crushing and chewing foods into easily swallowable and digestible pieces. They also help maintain proper positioning of the jaws. I hope this was helpful, and I hope you will be able to retain everything that was taught. Thank you.